Hello, beauties, and welcome back to Aesthetic Chat with Kiki. I'm your host, Kiana Gamble, and I'm excited to talk to this next guest. My next guest is Dr. Brandyn Dunn. He is a facial plastic surgeon, and what I think is really, really cool is Dr. Brandyn Dunn reached out to me to share his advice and knowledge to all of you. So, enjoy this one, beauties. First, I want you to just kind of talk about your background, schooling, and getting you to where you are today.
Okay, of course. So I grew up in Southern California. Right before high school, I moved to Hawaii, actually. And so I went to medical school at the University of Hawaii. And after medical school, I did my training at the University of California, Irvine, in head and neck surgery. And so I spent 5 years just working and doing everything in the face and in the head and neck region. After that, I decided to go into a fellowship in facial plastics and reconstructive surgery, and I went to a busy, high-volume fellowship at the University of Kansas. Finally, after I finished my fellowship, I came back to Orange County and joined a practice in Newport Beach, doing skin cancer reconstruction and cosmetic surgery.
Awesome. So how long have you been at the practice here in Newport Beach?
I started August of last year, so I've been there almost a year now.
Okay. And then I'm going to make you do a little math. Total years of schooling up until now. How many years is all of that?
4 years of college, 2 years of my master's in public health, 5 years for medical school. I took an additional year doing some research, 5 years for head neck surgery training, and then 1 year for facial plastics. So a long time.
Wow. So looking back and seeing all the things that you have done, my first question for you is, would you do it again? And what do you tell those people that are interested in, they're just in undergrad, they're kind of pre-med. Would you tell them to go down the route you're currently doing?
I would say that I didn't know what I was getting myself into. And in some ways it was helpful, actually. And so all I knew is that I really enjoyed medicine. I really enjoyed working with people. And that was kind of what led my journey. And I had some personal issues with my family where people had gotten sick, and that really got me interested in the field. And then as I kind of continued to go on, I would say there was a lot of ups and downs along the way, but where I am now, I am so happy. I love my work. I love working with my patients every single day. It is so rewarding. And so, yeah, I would say there are moments in time where I maybe didn't think I made the right decision, but now where I am now, I'm extremely happy.
Well, that's amazing. So how many days are you in surgery? How many days are you in the clinic currently?
Yeah, that's a good question. So the practice is extremely fluid at this point. So I'm early in my career. I'm building my brand. I'm building my practice. I came back to a really busy area of Newport Beach. And so my practice is more heavily at this point in skin cancer reconstruction. And as I'm building my cosmetic surgery practice, that's going to kind of grow over time. But I spend, surgery can be every day, or it can be, 1 day a week. And so most of the time I'm spending in clinic, and then whenever I have surgeries, it's kind of added within there.
Gotcha. And so roughly, do you know how many facial plastic surgeons are in a mile or two radius from you in Newport Beach?
Too many. No. No. Actually, I would say facial plastic surgeons, there's not. I was just on a call with one of my good friends, and we were talking about, so I'm currently at a conference of facial plastics, and it's facial rejuvenation and a rhinoplasty conference. And we were doing the math of, there's 50 fellowships in facial plastics and reconstructive surgery. And so every year, 50 people are graduated. And so in 10 years, only 500 people. And so it's really not a huge group. And that's saying that the same number of fellowships existed 10 years ago, and it wasn't. It was significantly less. And so in our area, I would say there's probably 10, 20, maybe 20 facial plastic surgeons specifically. And then the rest are, other types of plastic surgeons, other training.
Gotcha. So my next question for you is kind of overall, what are your thoughts on, dermal fillers, Sculptra? Just as a facial plastic surgeon, we can kind of get a wide array of opinions. So I'd love to hear yours.
Yeah. So I would say, I mean, they're great, but they have to be used for the right person. So, I would say there's so many different treatment options on the market. And so it can be really confusing for the consumer. And so I think that for the injector, for myself, I think it has an incredible amount of utility in prevention and also for kind of maintenance as well. And so even in patients that I do facelifts or rhinoplasties, there's utility in dermal fillers to be able to either really finesse or fine tune results afterwards, because, surgery is incredible, and yes, it's long lasting, but it doesn't come without risk, and it's not perfect. And so, the filler approach is also utilized in the surgical approach too. So, yeah.
And then are your same thoughts similar for Sculptra? Just because I know that Sculptra can be highly controversial, especially for someone who is performing facelifts. So what are your thoughts on Sculptra?
Yeah, I've had a lot of injectors ask me, people that are solely doing injections, ask, really, does it limit or influence our approach or the outcomes of surgery? I would say overall, no. It's I think the most important thing is that we're aware that, whatever treatments are known, so that we can at least kind of plan accordingly. And when it comes to Sculptra, I mean, it's your own body creating scar tissue around a foreign body. And it helps, but it doesn't preclude anyone from having surgery. I don't think it necessarily changes the outcomes from surgery. It just means that the surgeon needs to be a little bit more cautious and a little bit more meticulous in their dissection to achieve a good result.
So it seems very crucial for people to understand what they're having injected, and so they can be transparent with you.
Exactly.
So with these types of procedures, especially with fillers and Sculptra, is there an ideal time frame between someone doing filler and then you're allowing them to do a facelift procedure? Ideally, would you like to see filler Sculptra utilized post or maybe a couple years prior?
Yeah, I would say the more time between the treatment and surgery, the better. But, it's not always that way. So for Sculptra is really kind of more of a long game as far as getting benefits. And so I would probably wait 3 to 6 months. For filler, I typically would dissolve the filler if I'm doing like a lower blepharoplasty and they've had tear trough filler, or if they're having a rhinoplasty and they've had nasal filler. I would try to dissolve the filler, or at least wait for a year and a half for that filler to ultimately go away, so that I know what I'm working with and so that I can, use my judgment without being influenced by this, kind of this artificial variable.
Gotcha. And so kind of transitioning, we're going to talk about, liquid rhinoplasty. I'd love for you to chat about, who needs liquid rhinoplasty and then who should be performing it.
Of course. So for me, I think a liquid rhinoplasty has, at least in my hands, it has incredible utility. You can really fine tune, finesse, and contour the nose in ways that are really challenging to do with surgery. And so there's a huge role in it. But yes, I would agree with you. I mean, the nose is one of the scariest places to inject on the face. And I'm not sure if the listeners are as familiar, but, the big risk that we always worry about, at least with liquid rhinoplasty, is, vascular occlusion causing ischemia, or potentially the most feared complication, which is blindness. And that can happen in other areas. But I will say, even talking, and I just recently did a podcast with Dr. Rivkin, who's, one of the inventors and creators of liquid rhinoplasty. And even someone that's in the nose and injecting all the time and has seen the anatomy, there are still things that we worry about. And so, but we can do safe practices. And so I'd say the safe practices that I use to prevent complications is really small aliquots, always moving the needle, and, doing staged procedures. And so those are the big things. But if you think about injecting as every single time I inject, I am potentially in a dangerous place, then you will inject much less and you're much less likely to have complications. And then to your point that you were saying, who should be injecting the nose, I will say that obviously, even someone that's in the nose and sees the anatomy all the time, I still don't even know where the blood vessels are sometimes because everyone's anatomy is so different. So to say that only facial plastic surgeons should be, people that do rhinoplasty should be the people injecting the nose, I don't know if I necessarily agree with that completely. I think that if people are trained really well and they are honest with themselves and honest with their patients, and you have the mentorship to be able to learn these things and you've gone to anatomy labs, I think that introducing that into someone's practice is acceptable. But again, it's the honesty, it's being transparent. And then the other caveat that I would say is injecting in the center of the nose is the most important. So staying midline is the safest area. So just injecting the dorsum and just injecting the tip are the two areas where you can be the safest. I don't stray even from that area because I still I'm worried about complications.
Are you using ultrasound at all when you're injecting the nose?
I do not.
In terms of like longevity, and then what products typically are you using when you're injecting the nose? And then in terms of, when a patient asks, how long is this going to last? What do you kind of tell them?
Yeah, so I will tell them that, so the product that I use is Restylane L. That's the only product that I really feel comfortable using. I think that it has given me the best results. And so that's generally what I use. I don't use any permanent filler. I know some people do, but I don't feel comfortable doing that. If a patient wants a permanent result, I will discuss a rhinoplasty. And then as far as the longevity, I typically will say that it can last up to a year and a half, depending on the individual.
Are you seeing any issues with, say, someone really loves their result with the liquid rhinoplasty and, it's gone in a year and they want to come back? Are you having issues with injecting that same area again? Do you feel like you're not getting a similar or like an ideal result when you're injecting over and over and over? Or have you just not seen enough people back yet?
I haven't. Yeah, I can't really comment on that, but I don't see why I wouldn't be able to get a similar result. But yeah, I mean, I personally don't have enough experience to be able to comment on that.
Gotcha. And then when you're saying, small amounts in the nose, could you quantify like roughly how much you're using?
So I don't change it to another syringe, but probably 0.05 to 0.02. Like, I mean, really small amounts, and everything is going back and forth. And so what that means is many pokes. And what that also means is a fair amount of swelling. And so that's why I stage my procedure. So, your result is typically less than you expect at the second sitting, which is generally 2 weeks afterwards. And then I will kind of enhance it and add a little bit more. And most people want just to touch up just a little bit more that second time.
And then kind of looping back to what we were talking about in terms of like who should be performing the procedure. I totally agree with you. For someone that, has done their due diligence, is highly trained, has been doing injections a long time. But my concern is, especially with some of the people that could be listening to this podcast, is a lot of these injectors are new. And a lot of them are seeing, some really great before and afters, or they're seeing so-and-so inject the nose and they're getting a great result. So they're like, not necessarily, I wouldn't say they're well equipped to know how to manage complications. And so for those people, I definitely want to stress, like, do not perform liquid rhinoplasty. Some of these injectors have been injecting since, when Restylane came out. And so very, very highly knowledgeable people. And so I agree with you on that.
That brings up a really good point. So the big thing about injecting a nose is making sure that you have a protocol, a really well-defined protocol for every single time if you have any concerns about a complication from a liquid rhinoplasty. So, my treatments are aspirin, nitropase, Hylenex, a ton of Hylenex, warm compress, and then hyperbaric oxygen. That's for tissue ischemia. And then for a vascular occlusion, so I don't feel comfortable if there's a concern for like blindness or any sort of vision changes. Luckily, I've never seen it personally, but I have seen it come in through the ER during my training, which is really frightening. I would send it to the ER or have an ophthalmologic, good friend, oculoplastics or ophthalmologist that would feel comfortable injecting Hylenex into the orbit. And so those are, if you don't have these things available and set up and fully, well-tuned, then you're exactly right. You should not be injecting into the nose because those are the most important things. You need to be ready for it at any time.
So I do kind of want to transition, especially talking from a surgical standpoint. I feel like sometimes the newer injector does not know when they should, be sending people off for consults for surgery. So I would like you to talk a little bit about, facial aging concerns and when you think injectors should be referring to you.
Of course. Well, I wouldn't say there's an easy answer to this. I mean, I think that it comes with experience and comes with patient expectations. But, I find that most patients, and I kind of make a arbitrary cutoff, but I think that there's some utility in it. But, the age of 40, most people will do awesome with non-surgical treatment. After 40 is generally when you have to start thinking about other treatment modalities other than, injectables or non-surgical approaches. And so, when you look at the face, you want to assess it in all of its layers. And so for me, you want to look at the skin laxity. You want to look at the muscle banding or the muscle weakness, and then also fat tissues or a different fullness in different areas. And so, the changes that occur with aging become much more difficult to camouflage, which is ultimately what fillers do, the older and older that you get. And I think that it's not to say that fillers aren't good in certain places, like cheeks and things like that. But, when people tend to have jowling or they tend to have submental fullness with skin laxity or platysmal banding, those are things that are really much better treated with surgical approaches than treated with kind of camouflaging with filler.
Great point. In your practice, do you guys do other non-surgical treatment modalities like microneedling with RF and CO2 and those types of things?
We do microneedling. We don't have microneedling with RF available at our practice. I do CO2, I do V-beam, I do microneedling, I do chemical peels, I'll do dermabrasion for all skin resurfacing treatments. So yes.
And then for those listening, I feel like the ones that are in, more of the medical spa practices, I feel like there is a disconnect in sometimes understanding the roles of, CO2 surgery, things that you can perform versus someone that's maybe an RN in a med spa. So could you kind of touch a little bit on the role of CO2 and also when to kind of refer individuals to CO2?
Yeah, of course. Well, I think, again, all of this is really a continuum, but I would say that, CO2 laser is incredible. The results are spectacular in the right patient. It's for lower Fitzpatrick, 1, 2, maybe 3 with some pre-treatment, but anything higher than that, you really can't do CO2 laser. The CO2 laser has the ability to really adjust all of its power settings and all of these different things. And so you can kind of play with it and treat different areas of the face with different levels of strength. And so the big thing that it does is it helps with really just kind of giving you a fresh slate to work with. So it takes off essentially the top layer of skin by making small holes and introducing energy into the skin and causing the skin to tighten and also kind of take off the top layer. So it's really powerful, but it can also, in the right patient, it's great, but it also can cause complications too if you're not cautious.
You've only been in this kind of side of things for coming up on a year, correct?
Correct.
So, since you are newer to the cosmetic side of things, have you noticed as well that, they have really kind of divided MDs and non-physician injectors in terms of the space of education and even conferences and things?
Yeah, I think that there is a divide. And ultimately, one of my goals is to try to get more involved in the educational component. And, I think that people that have been injecting that don't necessarily have an MD, but have been injecting for 20 years have so much experience and that they could share as well. And so just because, we went through the school and the training, I don't think it necessarily, means that we're not on the same playing field at all. And so I would say, I think a lot of at least the injectable companies are trying to bridge these gaps and trying to, have people of all different backgrounds come and teach. And I think that's helpful. And I mean, I think it's helpful to have everyone sit at the table to kind of discuss these things. But yeah, I mean, naturally, I think unfortunately, in most societal things, we have our own categories and our groups and things like that. So there's some limitations to that, but yes.
Absolutely.
I don't know if that answers your question.
No, I think it does. I think that, again, within healthcare, there's like a natural hierarchy and there's a reason for the kind of pecking order, as you would say, in terms of safety. But I think it's great to hear from more physicians that nurse injectors that have been doing this a long time do hold value, and they do have a lot of experience and knowledge and things that they can bring forth and make the industry better as well.
Definitely.
So I do want to talk a little bit about, you working on building a brand, especially within aesthetic surgery and being in Newport Beach where there are 20 other facial plastic surgeons. How does that work for you being very new and kind of jumping into this realm that's cosmetics, that's also a different part of medicine?
Right. Yeah, it's not, I ask myself that question often. I have so many years of training in head and neck surgery, and I ask myself, why am I doing this? This is an uphill battle. I have a guaranteed salary doing head and neck surgery, but here I am, doing this uphill battle. And so I ask myself that, and I think really you just have to, for me, you have to have an answer of why. If you don't have a why you want to do this, then you're not going to be willing to kind of push through these challenging times. But for me, I would say, the biggest thing that I have is my ability to kind of go out and just kind of network and get to know as many people as possible. And so that's where I'm starting. And those are many of the things that I'm doing. So networking, going out into the community, meeting as many people, working with as many patients as possible, and providing good results. And then hopefully, ultimately, a word of mouth kind of progresses from there. And then the next big part is obviously a social presence. There's a lot of taboo and maybe some negative thoughts towards social media, but, there's no opportunity. There's no other opportunity in the world where you can have free marketing and you can reach as many people as possible. I mean, there's so many platforms out there with different ways of connecting with people based on either content or based on your friends network or your social network. And so my goal is trying to utilize those things to network outside of my immediate space. And so that's kind of where I am. I'd say the other thing is trying to figure out and kind of identify my voice. I think that early on, you don't necessarily have your message completely, fine-tuned and figured out. And I think that comes with time and just talking to people and learning more about yourself. But that's kind of where I am. And I'm enjoying the process as far as the day-to-day. I really do.
That's amazing. Do you think you are going to kind of wedge yourself into a niche of being kind of the liquid rhinoplasty, kind of that being your focal area? Just because I feel like a lot of, facial plastics end up kind of narrowing in on their like signature treatment.
Well, that may, there isn't really a big presence for liquid rhinoplasty in Newport Beach, and Beverly Hills isn't far. And, there's a few up there that are doing it as their signature, but that may be one of the approaches. I mean, doing facial plastic surgery, one of the unique sides is that, everything I know and everything I do is just within the face. And so I think that having this really focused understanding of the anatomy and how things work is kind of my unique approach to things, when comparing to general plastic surgeons who treat the entire body. I think that's one of the things that I try to kind of highlight. But yeah, I enjoy liquid rhinoplasty. And again, it's such a quick procedure with such incredible results that I think I will definitely continue to expand that.
And then one of my questions for you is, within your medical training and prior to transitioning more cosmetic, did you have any formal like business training, marketing training, anything like that? Or has it been a lot of learn as you go, or have you hired people to help you with marketing?
I didn't. It really has been learning as I go and just kind of talking and meeting with people and trying to pick everyone's brain that I meet along this journey. I just recently hired a social media marketing intern to kind of help me with post-production editing of videos and help kind of, she's in college. And so, maybe provide some newer, younger ways of thinking about different approaches and utilizing platforms and websites. So yeah, I'm excited. I think that there's a lot to learn, and I definitely did not have the foundation or the background starting out.
Did you think, starting out going to med school and things, you would end up having to learn how to, make Instagram posts and TikToks and all these different things?
I had no idea. One thing I always said that I wanted to do, and this is just kind of odd, but one thing I always said I wanted to do is I wanted to sell cars before I got into med school, because I feel like if you can sell a car or a used car, you can sell anything. And honestly, I probably would have learned so much along that journey and would have felt much more prepared. But yeah, I'm learning on the job.
I think that's very cool. I think that we all kind of are.
Well, I appreciate you putting these podcasts out, because it's just nice to hear people's stories and to see, people at different stages of the career and figure out how each person figures it out. Because, every time that you listen to someone's story or someone talk, you can always take a little pearl, and hopefully that will kind of help with your trajectory. So yeah, I appreciate you doing this.
Oh, well, thank you. I would like you to share with everyone, what is one of the major things that you have learned within this last year of kind of transitioning to cosmetics?
I'd say the one thing that I learned time and time again is to be honest with yourself as a provider. And so what I learned is that, sometimes you want to say what they want to hear, say what they think they want to hear. But I think, ultimately people are coming to you or me for my opinion and, my training and my expertise. And so, giving them my opinion and not kind of skirting around and just being very direct. I think that patients appreciate that. And I think that creates a very healthy relationship, patient-provider relationship. And so that's one thing I really have learned.
And for someone that is hoping to, kind of go down your same path and eventually end up in the surgical realm of things, is there one thing that you wish you would have known or someone had told you, any pearl of advice about the journey that they're about to embark on?
So much. I would say honestly, the big thing is just enjoying the journey and, appreciating your mentors and listening to your mentors and just kind of being okay with not making making mistakes and not knowing the right answer every single time, and just kind of enjoying the process of figuring things out along the way. So I think that's the big thing.
I know you're still kind of figuring out your own things, but if people were interested in coming to shadow you or watch you in the OR or watch even in-office procedures, is that a possibility at all?
Yes, I would love it. Yeah. Reach out to me. I can give you my email. And I'd be happy to coordinate anything.
Awesome. So tell those listening where they can find you on Instagram, where they can find your practice, kind of all of those contact details.
Yeah, of course. So again, my name is Brandyn Dunn, and my Instagram is Dr. Brandyn Dunn. You can find me on Facebook, Instagram, TikTok, LinkedIn. My website is brandyndunmd.com, and currently I'm working at the Appearance Center of Newport Beach, California. And so happy to see anyone or talk with anyone that has any questions.
Well, amazing. Thank you, Dr. Brandyn Dunn, for coming on the podcast. It was really, really fun to chat with you. So cool to finally have our first MD on Aesthetic Chat with Kiki. So thank you again, Dr. Brandyn Dunn, for chatting with me today. The podcast episodes and the podcast guests, they keep me on my toes. Love that I learn so much from each one. So Yeah, thank you for continuing to listen along. But you know where to find the podcast and all the details. But it's at aesthetic.chatwithkiki is the podcast Instagram. Aestheticnurse.kiki is my Instagram. You know, the website, aestheticnursekiki.com. Don't forget to check that out. You can find us on YouTube, Spotify, Apple Podcasts. But until next time, beauties, bye.